MRI or CT scan? Which one is the best? Today medical imaging methods are so diverse and precise. Some methods which we're using in the past decades are now out of option, because they have perfect alternatives nowadays. As the time passes, imaging methods become more precise and safer to use. All medical imaging methods divides into two main groups. X-ray-based methods, which are more suitable for bone sections in high-density parts like tumors. And non-X-ray based methods, which are mainly using to check out body's soft tissues and low-density parts. X-ray methods are 1. Simple X-ray radiography. 2. CT scan, stands for computerized tomography scan. 3. Mammography. 4. BMD, stands for bone mineral densitometry. And 5. Fluoroscopy. Non-X-ray methods are two types. 1. MRI, or magnetic resonance imaging. 2. Medical ultrasound, known as sonography. Let's check out these methods one by one. Radiography is the oldest and most simple medical imaging method. By radiating X-ray beam from a specific lamp to the desired body part, for a very short time, and placing X-ray sensitive films behind the body part, a medical image will be created. X-ray beam passes through soft tissues and changes the film's color to dark gray in that area. As the body tissue becomes harder and denser, it absorbs most of the beam's energy, creating a clear view of the hard tissue. Today in many countries and healthcare centers, traditional radiography has been replaced with digital radiography. The main difference between them is in digital scan. Electronic detectors are the alternate of X-ray films. So the final product of radiography is a digital image file instead of X-ray large films. CT scan or computerized tomography scan is the upgraded version of radiography. In radiography, X-ray beam is radiated only in one direction at the time, so the doctor could study the body part in 2D view and some limited angles. CT scan uses X-ray beam and multiple X-ray detectors. On the opposite side of a large and rotating plastic covered circle, the center of this circle is an empty hole where the patient lies down without movement. During scanning process, the circle rotates in high speed around the patient body. At the same time, X-ray source activates several times. Then digital data go into a computer software, and under some standard image processing algorithms, a full 3D view of the body part will be exported. Next method is mammography. Mammography is much like radiography, but it is used exclusively for women breasts examination, especially breast tumors diagnosis. This method has a key role in breast cancer diagnosis soon, and when it is in golden treatment time. Next, BMD, or bone mineral densitometry. BMD is a method using X-ray in order to calculate the approximate value of bone minerals per cube centimeter. This method is used mostly in people over 60, and is a common way to diagnose osteoporosis. And finally, fluoroscopy. Fluoroscopy is a X-ray based imaging technique, which could produce continuous X-ray images at a low frame rate, or even a full live view of the desired body section. This technique is mostly used in operating rooms and some invasive treatment methods.